Welcome everyone. I'm Ty Baker. I'm a program manager with the Wyoming Institute for Disabilities. And we are also representing the University of Wyoming Project ECHO. And we are one of the core USEDs that participated and ran the National Training Initiative for Project Scope. And we're going to go over a little bit more detail about what that is. And the model, the curriculum, and anything that we did. So what we would love to do, we do have limited time and there are a lot of individuals on the call. So please take some time. We would love to know who is here with us, and we're going to utilize the chat. So I'm going to share my screen so that you can have a little bit of a prompt, but we will do introductions again in the chat rather than going all the way through. So in the chat, if you could please put your name, first and last name.
Ty, while you're waiting to share your screen, maybe we can go around and introduce kind of the core scope team, at least. That was a really fun green screen that came up. So I'm Canyon Hardesty. I'm one of the associate directors here at the Wyoming Institute for Disabilities, which is a university center for excellence in developmental disabilities. So we could spend a whole lot of time talking about what a USED is, but we want to make sure that we get through the information related to Project Scope. But there's an entire network across the nation that are affiliated with university centers and really focus on improving outcomes in rural areas with a specific focus on individuals with developmental disabilities and their families. So I will turn it over to our other partners, but let's finish the Wyoming team. So if you want to go ahead, Amy.
Hello, everyone. My name is Amy Reeser. I'm a project coordinator senior here at the Wyoming Institute for Disabilities. And I do a lot of support for the NTI project across the country. And I'm really excited to see some new faces on our call.
Sandy, you go ahead.
Thanks, Kenyon. I'm Sandy Root-Elledge. I am the executive director of the Wyoming Institute for Disabilities, and I have the privilege of working with this great team and collaborating with all of the sites around the country. Thanks for joining us today.
Eric.
Hi, everyone. Eric Moody, one of the associate directors at WIND and also our director of research and evaluation. It's great to be here.
And Allie.
Hi, everyone. My name is Allie, and I work on the research and evaluation team at WIND.
Wonderful. So as part of this national training initiative, we've had a really cool opportunity to then work with another USED and some other experts in the topic area. Dr. Weber, I'll turn it over to you if you kind of want to go ahead and introduce your Ohio partners.
So hi, everyone. I'm Steph Weber. I'm a psychologist at Cincinnati Children's Hospital and part of the LEND and the USED there in Cincinnati, and members of the NTI Project Scope team, as well as leading Buckeye Scope. And another member of our Ohio team is Dr. Andrea Whitworth. So I'll have her introduce herself next.
Hello, everybody. I've been lucky enough to work with this team. I'm Dr. Andrea Whitwer. I'm the director of training and a psychologist at the OSU Niswonger Center. And I've been working with Steph on our Buckeye Scope, as well as the curriculum that we'll get to tell you about in a little bit.
And then Elsie, if you want to introduce yourself, rounding out the Ohio team.
My name is Elsie Bush, and I'm also on the Ohio team. I am an occupational therapist at Cincinnati Children's, and then I work as a research assistant for Project Scope.
Wonderful. And I know there are lots of other contributors to this project from Ohio that are not on. So yeah, I think in addition to making sure that we know who you are and where you're from, and what agency you're working with. We'd also like you to answer what's your current interest in this project, and potentially, then additionally, what's your interest in working with children and families. I think as we go through into the discussion, it will allow us to have maybe a more targeted discussion to meet your needs. We know everybody's time is incredibly valuable, and appreciate you carving out time today to be with us. So Ty went ahead and put in the chat name, state, role, agency, and then current interest in this project, as well as additionally your interest in working with children and families. So, we've been working on this project, and initially started with a pilot in 2018 and 2019, where we ran an echo, which we'll talk about here in a minute, for SCOPE, the Supporting Children of the Opioid Epidemic with Ohio, and individuals from both Wyoming and Ohio, participants, interdisciplinary experts. We'll again talk about the model here in a little bit. Worked on that project. From there, we then were able to receive some national funding from the Administration on Community Living to fund a national training initiative. And so we've had the opportunity, I would say, an honor to work with 14 other states to tailor and implement ECHO for SCOPE. So we'll be talking today about a little bit more about that, but that was the intent and purpose behind the project. So Amy, if you want to go to the next screen. This is just where we're discussing our introductions. Thank you for those of you who've started to put your information in there. Again, it'll be wonderful to help with the discussion later on. So the next slide really goes over the goal. And we're still doing data analysis and still working on this project, but the ultimate goal is to build nationwide provider capacity and confidence in applying evidence-based practices in screening, monitoring, and other interdisciplinary support for children and families. That will be pretty hopefully evident in the initial curriculum, as well as the things that we've tailored and things that our sites have really been able to incorporate into their echoes to meet those needs. So the next slide here actually is a video of Project SCOPE. It's something that we developed here as a larger team, including input from all of our sites, that will give you a very brief overview of what Project SCOPE is. We'll talk about specifics, the ECHO model and the curriculum here in just a minute. But Amy, if you want to go ahead and play that, hopefully, I know individuals will be able to hear, but this is a pretty, I think, straightforward and simple way to understand the project.
Children affected by the opioid epidemic and its related trauma have unique needs. Their families require additional support, and providers who support them must have the right tools to promote healthy development. Project SCOPE, or Supporting Children of the Opioid Epidemic, is an innovative national training initiative intended to standardize, develop, and expand educational practices to give providers the tools and the confidence to best address opioid-related challenges impacting children and families. Through collaborative video conferencing technology, Project SCOPE utilizes the ECHO model to bring together early child care and healthcare professionals and other service providers. Outcomes for children, families, and early care systems will be improved through interdisciplinary education and skill development, especially in historically difficult to reach and hard-hit rural areas. Project SCOPE provides practical applications of advanced and real-time research findings. For providers, it means better knowledge and skills. For children and families, it means better outcomes and hope. Learn more at nti-scope.com.
So hopefully that was able to give you a very high level view of what SCOPE is. And we'll be talking further about the outcomes affiliated with the project. So what you're here for today, hopefully, is to really to get oriented with Project SCOPE. If you're not already, we do have lots of our sites that are on today that will be contributing to the conversation a little bit later. But we hope for our other partners, your goal is to really identify the purpose and the reach of Project SCOPE. Again, SCOPE stands for Supporting Children of the Opioid Epidemic, although lots of the the training content will go beyond that. Really to describe how Project Scope, the larger national training initiative, as well as the ECHO scope individually, can continue to meet the needs of unique needs of states working to support children and families impacted by neonatal abstinence syndrome, neonatal opioid withdrawal syndrome, and some of those other things that come about with substance use and related trauma. It looks already, as I'm starting to kind of pay attention a little bit into the chat, that there are lots of potential opportunities to collaborate for individuals who are working with moms and kids and families that hopefully will result in collaboration after this project. And then lastly, learn how to leverage the success of this scope to address opioids related opioid substance use and related trauma in your states, as well as then thinking more broadly about how ECHO as a model for capacity building may also align well with other initiatives you have and in the land of training and capacity building. So this is a map on the left-hand side, and there are color-coded states who have been participating. So Wyoming and Ohio are the core kind of facilitators of the National Training Initiative. And then we have our 14 sites who are participating on the right-hand side. So we'll also provide links to the Project Scope website, as well as send out these materials to everyone so you can make sure to access those. But we have sites from Colorado to North Dakota to New Hampshire, Maine, to Georgia. So it's been a wonderful mix, I think, of regional perspectives, as well as larger national representation. So how many of you, by raise of hands or reactions, have heard of the ECHO model, so the Extension for Community Healthcare Outcomes? This isn't a quiz for our site teams, I promise. Great, Betsy. Perfect. So I'll go through this briefly, but I think it really speaks to, in our discussion, when we talk about using training models and capacity building models, how ECHO may differ as a result of really focusing on interaction. So ECHO is really about bringing together both experts and communities to contribute to a conversation about implementation of best practices. So different than a webinar where individuals receive the information about the best practices, ECHO is focused on implementing those practices. So hopefully even today, you'll learn from our NTI scope sites, and tomorrow you can pick up the phone and maybe have some conversations about what that might look like. In an ECHO session, it really is then about how are screening practices, how are supporting in children and families, how does that look from the practice perspective or from the evidence-based practice perspective, and then the implementation perspective. So there's really a panel of hub experts who contribute to that conversation, and a core set of individuals that may represent peer support specialists, nurses, they may be pediatricians or psychologists, as well as nurse navigators. We've had a very interesting level of participation actually from the family services perspective, as well as the court system. So that's changed a little bit about what this looks like. Steph and Andrea are going to talk about that. But I think those hub experts really evolve as your state system may be set up to support this family. So again, it's not meant to be a training. It's really meant to be a community of practice where we're seeing the same people. People can participate, even if they're not in routine participants, but meant for individuals to participate, learn together over time, and then develop what we call a community of practice. So go to the next slide, Amy. ECHO really is about all teach, all learn. So it's intended to be interactive. It's intended to really focus on co-management of conditions. So ECHO is split up into two sections where you do training on best practices for the first part, about the first 30 minutes, and then the last 30 minutes, you focus on an actual case. So something that individuals may be working on within an early intervention system or potentially with a family member, and utilize this large community of practice to brainstorm next steps, to brainstorm strategies that might work. Peer-to-peer learning, although these ECHOs are set up with experts, we really are all working together to improve outcomes, and as peers want to be able to share that information with one another. Finally, and I know I mentioned with co-management, is this really is a collaborative problem solving space. We're all at different places geographically, professionally, personally, and we all put those hats on the table and those perspectives in order to come up with some hopefully good strategies and problem solving approaches as we're working through this. There's a diagram on the right-hand side that actually gives us some specific information on the core components of ECHO. So ECHO is virtual. In this virtual environment, we do core training, case presentations, and then of course measure outcomes. You'll see outcomes today that are for the larger national training initiative, but there's also lots of data from the individual implementations from each of the states that we could share, and participants may even want to share in the discussion. The next slide. This really talks about the key components, and this we actually used from a previous presentation, and I believe that Minnesota contributed this image. So I'm not sure if they're on, but you're more than welcome to hop in.
Yep, that's our picture. This is
Perfect. Drake, do you want to?
Minnesota. Hi.
Yeah.
Yep. So yeah, that's just a screenshot of from kind of the beginning of the presentation after we introduced the ECHO right before our presentation, and you can see it's a normal Zoom session. So yeah.
Yeah, so when we talk about an ECHO scope implementation, we're really talking about 8 to 10 weeks of delivering training content. These sessions are about 1.5 hours. Some of them are an hour, which is really difficult. Some of them are 75 minutes. The states who've really been able to do them in 90 minutes, I think have really been able to have some robust discussions. There are speakers from the respective states and communities, again, including those interdisciplinary professionals, physicians, researchers, policymakers, and then of course the community of parents and peer advocates. Each ECHO session must include a case or an area where we're discussing best practices and application of those trainings. And then each of these states, Eric will be talking a little bit later, have done multiple implementations. And hopefully that has contributed to communities of practice within your state, as well as across the regions that people are coming back to contribute to the conversation. Next slide, Amy. And Dr. Weber, we'll turn it over to you, or Andrea. I saw you just, Dr. Whitwer, you unmuted, so I'll turn the baton over to you.
I get the first slide, then I will pass it off to Dr. Weber and Elsie to talk about it a bit more. So as Canyon said, part of the ECHO model is the didactic piece, which is that spreading information about evidence-based practices. The reason that Dr. Weber and I were so lucky to get linked with the Wyoming folks is we had started to work on a curriculum based on some of the needs we were hearing from stakeholders in our community related to meeting the needs of families and children. And so if you look on here, you really see a really wide-ranging list of topics, but all that really relate to that microsystem and that more macro system of different things that are impacting the children and the families. We'll talk a little bit later about how each state has evolved their curriculum over time. As we have even looked at our core curriculum, we've added in things such as peer support, fetal alcohol spectrum disorder, infant trauma and mental health, also intergenerational trauma. But you see in here issues related to both substance use disorder as well as the effects on the infant, but also understanding more of that family aspect with trauma, all those pieces. All of these curriculum models are based on literature reviews, as well as working with individuals with experience and experts in the field. So I'm going to go to the next slide, Amy. What we've really tried to do within our curriculum is to really have a whole idea of what is the integrated care model that we could put in place for families and children to help meet their needs. It's a really complex set of folks with all of these different areas that need to be considered and all these different systems that they're working with, both within healthcare, the community, as well as within their home and all of those different pieces. So I think as you see us talk about different aspects throughout this presentation, you're going to see this real goal. And one of the nice things that comes with ECHO is this ability to have that problem solving and really to be able to take that evidence-based curriculum and work through what does that look like in our model of care? What does that look like in our community? Go ahead, Amy.
So I'm Steph Weber. I am Andrea's counterpart in Cincinnati, and she's in Columbus, Ohio. And also we have worked with Elsie Bush, who has been such an instrumental part of this. And so I'm going to have Elsie describe the resources, the current resources, and then I'll go into some of the tailored opportunities later for using what we've already gathered across this grant cycle.
Okay, so kind of the overall goal of our curriculum resources, like Andrea and Steph has said, is that we wanted to provide a starting point of all that essential knowledge and info for our states as they went on to implement their own ECHO trainings. So these materials were really tailored to the scope curriculum topics that were outlined in that chart about 2 slides ago. And the curriculum evolved over time, which we'll talk a little bit about that later, but we basically worked to identify what gaps or priorities are we needing this information for. And you can go to the next slide. And so within our curriculum, each of our topics got broken into what we're going to call a guidebook. And each guidebook includes a PowerPoint outlining up-to-date research on that topic, pulling from current research and literature, as well as professional guidelines and policies related to those topics and resources like caregiver education tools or resources that providers would find helpful when working in that area. So overall, our curriculum really was designed to just bring together all that existing knowledge and resources so our teams can go ahead and work to teach others about how to best support children and families impacted by the opioid epidemic.
And so jumping back in, this is Steph again. We really guided our initial curriculum to be focused mostly on those early childhood years. And so you see the little baby in the image to the left, because that is what we know from the research. Elsie has done an amazing job, as well as our other Ohio team members, to compile all of the published literature, but also some of those gray resources that are out there as guidelines and suggestions, and just what do people know, because there is relatively little published knowledge outside of the neonatal period. And so what we hope to do then through this curriculum is to add to that what we know about some of the behavioral difficulties, the executive functioning issues that children in preschool and early school age face. And where we are at now is really focusing on how do we move the needle on understanding the supports that are needed through childhood and adolescence, and learning from the work being done in the fetal alcohol spectrum space, but also what we know from the developmental disabilities literature, and making sure that we are casting a wide net and including these children with prenatal opioid exposure in those domains so that they don't get lost in the shuffle between mental health services, developmental disability services, but that really it's a coordinated process for these children and families to receive the necessary healthcare and educational services and resources. Next slide. And so some of the really wonderful adaptations that our teams have made throughout their implementations have included bringing in things around what are the court processes for families and understanding safe baby court or whatever it's called in that particular state or community, understanding the child welfare system and plans of safe care particularly. How do we understand how foster care is embedded into these systems and how so many of these children do have foster care or state welfare interface. We've talked a lot about how we specifically weave in ACEs and trauma. And I love the way that some of our Indigenous communities have done that, also interweaving the rural approaches and the differences needed based on what ECHO is good at, is identifying and connecting people when there isn't maybe a whole lot available in those communities, but giving them knowledge that may not otherwise exist in their local area. We've spent a lot of time focusing on what are the models of care based on the social determinants of health that are needed moving forward, and then sprinkled in some specifics, things like the visual development and the needs that impact kids with neonatal abstinence syndrome, or looking at more of a broad scope related to fetal alcohol spectrum, as we mentioned. Next slide. And in the areas of where we can move in the future, we have had some folks really focus, especially our Georgia friends, focus on interweaving this with challenging behaviors and what we can do from a mental health and behavioral health perspective. And then digging in even more in depth with some of those nuanced needs that these children have, such as gastrointestinal issues, neurology concerns, some of those long-term impacts that we mentioned earlier, as well as suicide prevention and substance use prevention. We know that this population is at higher risk throughout their lifespan. So really focusing on that mental health of the entire family system to be preventative and resiliency building. And again, as we move forward in terms of looking at children aging out of the early intervention system and getting into school, what do we need to do to prevent classroom expulsion, preschool expulsion? What do we need to do to prevent special education difficulties with obtaining services for children with learning differences? And so that has really kind of build us up to have a really nice core curriculum, and ways to build these nice communities of practice, but also moving into what can we do in the future. And so Amy, next slide. As you can see, we've been able to build this curriculum in a way that is modifiable and adaptable for the learning needs. And so it's all based on these case-based learning opportunities, and these can move forward in various ways. We have the didactics recorded so that there can be an opportunity for groups of learners to take those and asynchronously learn, and then build in future echoes to get more in depth into some of those nuanced areas, like we mentioned with visual differences or neurology differences. The hub team expertise has expanded greatly. And so we know that we have a wide array of different teams across the different states that we can draw from each other too in this network. And then in general, the idea about the communities of practice and how we've interwoven, I should say, those with lived experience, and really made sure that people with substance use disorder, especially those at the time of pregnancy, we're hearing from them, and we're hearing from them particularly about their fears and how we can make health and education for their children and for themselves better moving forward. So I think we've been really able to diversify and meet different needs, and only want to increase that in the future. So with that, I think that's my last slide, and I'll turn it over to the next presenter.
And I think I am the next presenter. So thanks for that background, everyone. And now it's my chance to talk with you about, well, what is this actually accomplished? And I gotta say, it's pretty cool. So Amy, why don't you go ahead and go to the next slide, please? So very, very briefly, we're going to talk about some of the results of our evaluation of the SCOPE project and the impact that it's had. And I should say, in general, what we're looking for, if, as Canyon said earlier in the talk, what this is all about is about building capacity in local communities that otherwise wouldn't have access to the skilled practitioners that they need in order to serve kids with NAS. And that means we've got to find and access those clinicians, get them the training in a way that works for them, and make sure that it impacts their knowledge and skills and that they do something with it. So that really has been our approach, is to focus on the reach of our of the NTI network and its impact on knowledge of skills of providers, and then how much they're actually using it. So what we've done, we have a standard evaluation protocol that we use for all echoes, and how it basically works is that we do a traditional pre and a post. So at the very beginning of a network, we get some baseline figures, knowledge, some demographics. Who are you? What's your practice like? What do you know? We do that at the end, but then we also do weekly evaluations as well. They're much, much shorter. And throughout all of it, what we're really focusing on are those things that I talked about before: reach, impact on knowledge and skills, and then intention to implement. We did that for every single state that was in our network, and then we collated everything. So what I'm going to present now is that collated data from the 14 states plus the 2 original sites. So let's just dive in. I think the first thing that was really cool is that we were able to train the 14 states over the course of the project, which was great. That led to a total of 32 implementations of scope. And when we talk about unimplementation, what that basically means is every time a hub team, they say, okay, we're gonna run through the whole shtick again from beginning to end, all 8 sessions or however many they use, that is an implementation. So in this relatively short period of time, by us training these sites, they were able to do this 32 separate times, which was great. Some states did it a couple times, some states did it 4 times. So it was really based on the local communities deciding how much they really wanted to do that. But that led to a really large number of overall implementations, which, and if you look at the number of sessions, turned out to be 270 total sessions. And that translated it then into 350 hours of total education and training. But here's where it gets really cool. If you look at how many participants there were, and these were duplicated, there was over 10,400 ECHO participants. So these are the clinicians getting trained, which is just a really remarkably large impact for such a small input of time and resources and training. So that's a really key thing. So, just from those 32 implementations, 270 sessions, we've reached over 10,000. We say over 10,000 because we're still getting data from a couple more sites. That will bump it up a little bit, but this is a fair ballpark. And then, as was talked about before, the ECHO model is really about training clinicians so that they can then take that to impact their client load or patient load. And this is where it gets really cool as well. So from those over 10,000 participants, they were, and this is based on their self-reported number of kids on their workloads who have been impacted by opioid use and related trauma. It was 141,085 kids. So that is just a tremendous, people talk about the amplification of knowledge that ECHO is able to accomplish in a really relatively short period of time and for, again, fairly little input. So it's, and I think it's been remarkable in the impact and reach. So let's go to the next slide, please, Amy. We also wanted to look at, well, who are the providers, clinicians, whomever that are joining. We asked them what's the primary system that they work within, and it was remarkably diverse. I will add, this is of 12, just over 2,000 participants. There was over 10,000 duplicated. This was people, this is unduplicated. And I would also add, this is not the total number of unduplicated. This is just the people that actually completed the evaluation. So it's going to be considerably smaller, but I think this gives us a relatively good idea of just how diverse the participant base was. So we've got social workers, EI, service coordinators, home visitors, center directors, PTs, OTs, early childhood, infant mental health specialist, speech language pathologist, nurses, nutrition manager, on and on and on, Part B, Part C. And so these were the occupations and the systems. The systems included Part B, Part C, Head Start, Early Head Start, and you can see it's just remarkably diverse. And I think that's the key. This works for a lot of different types of disciplines and providers in different systems, which is critical. Let's go to the next slide, please. And this was something that I think was completed just recently. This was a word map then of the different roles that people tended to have. And you can see, again, there's a lot of diversity, infant mental health, manager, therapist, consultant, nurse, childhood specialist, coordinators. So again, really, really diverse. Let's go to the next one. This is one of my favorite figures. And so what we do is we get from each of the participants that turns in an evaluation a little bit of information about where they're actually located. And this is based on county. We do have the ability, once we get some additional data, to go down even further. We'll be able to do this based on zip codes. But for right now, this is just county based. But every little blue filled in figure, that actually represents a county that has participated in an echo. And I think what's really critical is look at some of the states like Arizona, that, you know, so they've got very large counties, but it's still capturing some extremely rural communities. Same with Colorado. This is, excuse me, you know, Colorado has kind of an urban corridor right along the Front Range between Colorado Springs and Fort Collins, but all of those other counties in the periphery are extraordinarily rural. Excuse me. And as Candy was talking about before, this really is kind of a regional approach. And you can see, so the kind of west, southwest, the Midwest, Appalachia, Georgia, the Northeast, all of those counties are there, that represents participants. And what's really cool is when we looked at each individual state, it's remarkable how diverse the county representation is. And that's really the key of ECHO. It's able to connect with people wherever they're at, and that leads to pretty profound impact. Next slide, please. One of the things that we wanted to know a little bit more about was, in terms of the people that were joining, well, what has been their experience with opioids, and then also trauma. I want to start with the bottom one first and work my way up, because I think this is interesting. So, and this really gets at the need. You know, what do people need this training? And I think the answer is yes. Interestingly, at the bottom, it talks about how many people have received some kind of training in trauma or trauma-informed care. 84% have. And it, at least in my mind, that makes a lot of sense. Trauma-informed care is a really big topic these days. But interestingly, if you look at the one above, how many people have received training on the opioid crisis and its impact on kids? Well, it's almost an even split between yes and no. And so, you know, again, of the people that responded to the evaluation, 47% have had no exposure whatsoever to the opioid crisis, and in particular its impact on children, which I think is a really important reason why SCOPE exists. There's clearly a need for people that are working with these kids to be able, and remember, we're talking about 150,000 of these kids. But if they've not had any exposure to training, this is a really important opportunity. Let's go ahead to the next slide, please, Amy. As I said, one of the critical things that we need to be able to measure then is, well, what is this doing for people's knowledge and skills? And then more importantly, their intention to use what they've learned. And so here, these, again, this is the subset of people that responded, but I think it's a pretty good indicator. The blue, so I'm looking at the blue figure here, and if, I'm sorry, the left-hand figure, and I'm looking at the blue bars, this represents their knowledge before being involved in the ECHO. The green bars then represent their knowledge afterwards. And if you kind of mentally separate these, what you'll see is that, you know, by and large, the most common response for people beforehand is that they're moderately knowledgeable, but that really shifts over to very knowledgeable or even extremely knowledgeable afterwards. So what that really indicates is that there is a very significant improvement in people's self-reported knowledge after the fact. We're looking more into their specific knowledge about opioid-related information, and the t-test for this is outrageously significant. If you're statistically minded, it's like less than 0.00001. It's very, very, very significant. And that's been our experience with ECHO sort of since day one, is that this has a really important and profound impact on people's knowledge about topics that are critical to their ability to do their jobs. But I think the next one's even more important. So the question here was, I believe that I can successfully apply what I've learned. And there's, you know, those two tiny little slivers up at the bottom. Don't worry about those. Look at the kind of the greenish color and the tan color. Those are the people that agree or strongly agree that they believe that they can do what, use this information within their practice. And we've then looked even further and asked people, well, when are you going to use it, or have you used it? And it's remarkable. I would say it's something like 80 or 90% said that they are either have used it or plan to use it within the next week. So the point is, it's not just that people have learned information that they can just store in their brain. They're actually doing something with this. It's actionable information, and it's directly impacting their practice almost immediately. That's the point of ECHO. This is about capacity building. And by this evaluation, it looks like we've been successful in being able to train a lot of providers to impact a lot of kids with NAS. And I think that's the last slide for me. So it is. Thank you.
Great. So before we hop into the discussion section, our sites are really the ones who've been implementing this since we began this work in 2019. So do want to open it up. What things didn't we address? What areas would you like to clarify about the approach, or that I might have not discussed about ECHO or the curriculum? Anyone and everyone from all of our sites. What else would you like to contribute? A key part of ECHO is, oh yeah, Lori raised her hand. Great, go ahead.
Hello. I just wanted to say, as somebody that was a participant for the past 3 years, we've got this wonderful curriculum that was developed through really impressive folks in Ohio and Wyoming, and then updated to be specific to North Dakota. And just during this time period, we've connected with someone in South Dakota that's looking at getting started with this. And I think I will speak on behalf of all of us that have done this already. We want to continue to share. This information was shared with us, and we want to share it with other people. And any way that any of us that have done this before can be helpful, please just send an email or a phone call, or connect with the folks at WIND and ask them who's closest to you, and we'll be really happy to participate. So,
okay, well, thank you, Lori. Okay, I think we have several discussion questions. We are going to keep individuals in a large group. I will say, and when you're talking about ECHO, we really like to encourage lots of conversation, normally break up individuals into small groups, but given we only have a little bit of time today, and there's such vast expertise across the nation, we want to make sure that everybody kind of hears those conversations or participates. Again, you can participate in any way you feel comfortable. If you want to put information into the chat, you're more than welcome to raise your hand, as well as feeling comfortable just to unmute your lines. Okay, go ahead, Ty.
Yeah, so, and Kenny, we do have a question in the chat as well from Teresa. And Teresa, if you want to unmute as well to elaborate or explain a little bit more about your question, but I will read it. It says, can anyone talk about how and if this worked to address specific populations? For example, someone mentioned the Appalachian areas of the state. I noticed people working with Indigenous people, etc. And so Ohio, Arizona, if you all are on here and you'd like to maybe talk a little bit more about that, that would be great.
Yeah, I can talk from Ohio's perspective. So for those of you who don't know, Ohio has a large Appalachian population, and we really, from the start of building our hub, we pulled in nurse navigators from that area so that we could have their lived experience and expert experience to be able to help us to reach out to providers in that area and be able to kind of speak to the specific needs. So it was very much kind of part of how we built our hub team to include members from that area, and have worked to kind of recruit hub and spoke members from that area going forward.
This is Steph from Ohio as well. I will add that we have recognized the need for further. I feel like we've kind of scratched the surface. We definitely have data to show that we've reached Ohio Appalachian communities, but I think that we need to do some more granular analysis to see which disciplines we've reached, which community agencies we've reached, and then partner. We've already kind of been in discussions with Caroline and her Kentucky team to look more at the Eastern Kentucky and southeastern Ohio areas. And then that will likely bring us to conversations around maybe a regional approach with West Virginia to really target more specifically some of those systems and those folks that are impacted when they have to cross state lines for their care, which we know exists at least in our area. But I'll turn it over to the folks that worked with the Indigenous peoples, because I think that was some really wonderful work too.
I'm not sure that they're able to join today, but yeah, I think, you know, one of the things that it's important to mention is that, you know, we've talked a lot about diverse needs of each state. And one of the ways that the ECHO model is established to do that is that you establish your hub or your core planning team to represent and to be interdisciplinary of the same populations and the same, you know, specialties or needs that your state is in. So I think a huge part, and what we saw in Arizona specifically and some other states, is that, you know, making sure that the planning before it was even implemented included populations that you also wanted to serve, to make sure that those cultural, you know, aspects are included and the voices heard throughout the entire process. Lori said it's important that we always remember to include the people of any specific region, nothing about us without us. Thanks, Lori. So Amy, do you want to go ahead and share, and then I can walk us through the discussion questions and just some ideas, and really one of the main purposes of having this conversation and this call today. So again, thank you all for your time. I know that we are all busy, and so taking an hour sometimes is really difficult, but for the remaining of the time, we would like to just have an open discussion around opportunities that may exist to continue to meet your state's needs specifically, or even regional collaborations. So we heard Ohio talk about that they're already working with Kentucky, and there's been ideas in the South with Georgia and surrounding states around them. You see kind of the Mountain West states with North Dakota and South Dakota, Colorado, Utah, Arizona, as well. So I think just regional collaborations, and then also at a national level, there are already states who have taken this model and adapted it to other needs within their areas, whether it's mental health, dual diagnosis, family support, early intervention, and developmental monitoring. So that's been really cool on our end to see the sustainability of how this ECHO and how the ECHO model has been built into existing, you know, core funding and responsibilities of their organization as they move forward to address other needs that they have and states as well. So what I would like to do is just open up the discussion, and even if it's not a formed thought, and it's maybe just a brainstorm or an idea, please feel free to share that. But what opportunities do you see exist to continue to utilize this model within your own state or within your region?
I'd be glad to chime in. This is Betsy from the University of New Hampshire, and we have had a two-state ECHO scope for the past 2.5 years, New Hampshire and Maine. And we are small geographically in the Northeast, but we're also very rural. And so having New Hampshire and Maine collaborate together on New Hampshire, Maine ECHO scope has been really interesting. And two things that I want to just say that have been really, I think, really successful aspects of our participation in the NTI was situating this ECHO scope within our LEND program, because we have LEND faculty expertise that is already, you know, sort of convened around running our LEND program. And for LEND, I can't remember if you did an overview of LENDs for people that might not be familiar, but it's a federally funded training program, and we have interdisciplinary faculty that work together, particularly around early intervention, diagnosis, and prevention and treatment of developmental disabilities. And so we had this group of faculty in New Hampshire that also, our LEND program is also 2 states. So we already had a group of faculty who are really interested in early intervention. And so the scope opportunity was a great one for our faculty. And I think it goes beyond to what Ty was just saying, that this same group of faculty is interested in early infant mental health and behavioral health and diagnosis of developmental disabilities and dual diagnosis. And so I can see into the future lots of opportunities for this group to work together. So that was one thing I wanted to share. And the second thing is that to the question that was in the chat a moment ago about, how did you identify specific populations? In our EchoScope, and I think in lots of the other ones, we started by, as who was just speaking? Was it Andrea? About identifying the hub members who would be the most strategic member of the state system, who might be working with multiple populations in your state, or a specific regional participant from to join the hub team. And then, so identifying who would be on your hub team very strategically is one. And the second is recruiting participants for the scope. So our first time we targeted early intervention professionals. The second time we cast a wider net, and we ended up with lots of behavioral health professionals and fewer Part C early intervention professionals. But each of those people that participated in our EchoScope were working in different regions of the state. And seeing Eric's slide showing how much of Maine and New Hampshire were covered in our 3 echoes was very heartening. I hadn't seen that slide yet, which is really great, because the big square, white square in the middle of the state of Maine that was not covered is actually wilderness. So it was almost the entire state, which is terrific. So thinking about reaching specific populations, we thought carefully about which part of the system would have the most access to that population, and which disciplines or which parts of our system could we target to recruit from. So I hope that I feel like I'm muddying my words, but hopefully you understand what I'm saying.
I think the kicker, Betsy, is also that you have these people already at the table, right? I mean, you've created relationships with unique populations, with unique providers, who you're really finding out that are doing really amazing things. And Echo does provide that platform to bring other individuals to this conversation. I will say the court system, right? That wouldn't normally engage, or maybe they would, with healthcare providers or not, or early intervention providers in those different ways. And all of our states have done a phenomenal job of bringing together quote unquote non-traditional partners to the table. And I think the kicker is, even for individuals who are not on the call, is there is an opportunity to leverage the work of individuals in your state who've participated in ECHO. I see some names on here from federal agencies, from state agencies, and would love to find out even from those, the individuals who are not part of the SCOPE project currently, how you see or you think of that ECHO could be part of your work. We would hate to miss that opportunity with the amazing relationships that Betsy's had, or Arizona has made, or the partners, that have been part of the South Dakota work. So what are others' thoughts on how this can be leveraged for the work that you're doing, for partnerships you're engaging with, for individuals with children and families across our region? Christina, I saw you turn your video on. If you'd like the floor.
Yeah, I'm happy to make a comment, and good morning, everyone. My name's Christina Mead. I'm the regional pharmacy consultant with Health Resources and Services Administration in the Denver regional office. And the information that was presented, Eric, those are some really great metrics. And the question you asked, Canyon, really has to do with what are some leverage points for partnerships and expanding, your community, if you will, to have the same priority on supporting kids. And, you know, I think that there are a couple of ways of doing that. Certainly, each one of your communities is going to look different. That's the assumption I'm making, is that every single one of these ECHO communities has their own priorities, their own specific challenges, their own populations, if you will, that need certain things. And I think that that can really help determine the type of partnerships that you create outside of the ones that you already have. And whether that's at the state level, you of course always have federal partners in your region. I'm one of 10 regions across the United States that has federal partners consisting of HRSA, SAMHSA, the Office for the Assistant Secretary for Health, ACF, ACL, which you're very familiar with, that can help make some of these linkages for you. I'll go ahead and put a map in the chat box there, but you know, I could talk about this all day, but I won't. I just wanted to throw a plug out there for really working with your state and federal partners. Even if you're not sure what you're asking, it's okay to make a cold call and say who you are and what you're doing and what you hope to get out of it to help you make some of those matches. And like Canyon said, really leverage resources as you see your priorities forming. Thanks, Canyon.
Are there any other states or sites that would like to kind of jump in here, or any of our other partners that are on the call that would like to just mention or think out loud opportunities that may exist with this work?
Ty, this is Betsy again. I'm not sure if this is the direction you want to go, but one of our biggest questions in our EchoScope is how will we sustain the funding into the future? And I'm not sure, again, that you want to go in that direction, but it certainly is sort of the biggest challenge that we face in thinking about how to sustain the work.
Yeah, great question. I don't think that you're alone, Betsy. And I think one of the reasons why we definitely wanted to have a discussion and brainstorm of this caliber today. Teresa, thanks for your comment. She's mentioned, I'll speak for the Modest folks from Ohio to say that I've seen them use the convening skills, partnership building, etc., and other work they're doing like Act Early. So yeah, leveraging other programs for sure. Okay, so we do have, Christina, do you want to go again?
Yeah, I have some thoughts on sustainability. And you know, federal resources are not the beginning and end of sustainability by any means, but I do think it helps local communities, and the intention of especially large state block grants is to really target, you know, programs that have measurable successes such as this one. So some thoughts that I have, and stick with me here, but I heard some of you are very rural. You know, if you're working with rural communities, I think that USDA may be a good partnership for you. Every state has a state director at USDA that may have some areas of funding that could support what you're doing potentially. I think your state behavioral health directors, if you're getting into, you know, a very distinct behavioral health piece, which I'm assuming all of you are, you know, SAMHSA funds very large block grants for state opioid response, and then mental health block grants that can help at the state level. Of course, if you're looking at racial disparities, your Department of Health is funded by the CDC to help with some of the racial ethnic health disparities that we've been seeing for years, to help address some of those. Of course, you have your maternal and child health director, your Title V director in each one of your states. I'm sure many of you are working with them already, but they also oversee a home visiting program supported by HRSA. I could be missing a few, but these are in terms of some of the potential federal partnerships that have state representation where you are, that could help with some of the sustainability funding in the future. And I don't want to put my colleague Lori on the spot, but in case I missed anything, I'll pause there for her to comment.
I think you got it all. Thank you.
This may be a follow-up to that. Thank you, Christina. Ever since we started doing this work back in 2018, there was this idea of there's a lot of money coming from the federal government into the states that's particularly focused on addiction prevention and substance use disorder treatment, and it's mostly geared towards adults. Are there folks on the line that have ways that we can advocate as a collective to really talk more about how do we get sustainable funding and just more discussions at the state and the federal level around supporting the entire family, and so that we make sure that we aren't just an afterthought in how to support children?
Steph, if that question was for me, it sounded like it was also for the general group. This is where I think it's really essential to maintain connections to what's going on at the state level. There's always, that you're I'm feeling like even child welfare agencies within your state can give you a sneak peek as to what some of the priorities are, so you can strategically place yourself where you need to be in order to be part of those conversations. I think the first step is being at the table, which is sometimes kind of tricky. But in having the level of data that you have and the clarity of what you're doing, you can show up with that really brief synopsis of what you're doing, why it's helpful, and where you hope to go, where you want to be, and what you need to do that, which I think might bring you to the table in a way that would be helpful to not only leverage what you have, but expand what you have among other state agencies that may be considering the same thing you're already doing and may not know you're doing it.
Oh yeah, I appreciate that, Christina. Yeah, the question was for everybody, but I loved that you jumped in, and thank you so much for that. And it's a matter of knowing who to get on their, like what agencies, what folks in our state to even get on their radar.
So I guess, in the last couple minutes that we have of this webinar today, I would love to hear how sites, yes, want to continue this work in scope and want to support, as you've seen, the significant data that says, yes, we want to continue this work, but we also want to learn about other areas that, and this may speak to your comment, Steph, have to do with, yes, a problem, but have to do with the larger system and the family, even outside, opioid and substance use. So would love to hear, because I know other states have utilized this approach, yes, for Act Early, which is, been a great collaboration as well, but for other topic areas and other approaches to work they're doing. So if any of our states would be willing to share, yes, they will plan on hopefully continuing scope, but how else they hope to continue other conversations, utilizing this module, utilizing this curriculum in their states. So I know, Steph, you and Caroline also talked about your work in Kentucky, which you could mention again if you wanted, but would love to hear, how states have applied their learning.
I can talk briefly about the model and how we've taken the model and are planning to use a very similar approach to address mental health needs for adults with disabilities in Ohio. We need to train lots of different types of providers. And we've identified through this Project Scope project, when you have this curriculum, when you're able to reach out to these interdisciplinary groups, the powerful learning community that you get. So that's a project that we'll be going through the next few years, is really taking this model and how we've learned and use it with the different content, but using just the same practices because they've been so effective with Project Scope. I see Caroline saying in the chat, in Kentucky, they're more active in the AUCD fetal alcohol spectrum disorders special interest group to consider ways to expand services.
Hi, this is Lorraine from Colorado. And so I was just very interested in what Andrea said, because we had proposed to, basically take this model and expand training in mental health for young children with disabilities. And we had submitted a proposal to SAMHSA in February of 21, didn't get funded, but I recently received an email from them asking if we were still interested in going forward. So there's no They said there's no guarantee, but they, wanted us to ask a series of questions, and, I've done that. So now we are sitting and waiting. So, so hopefully that will come through. And if it does, I will probably be in touch with you to see how it's going. But, we were really pleased about that. So anyway, I think it could be a really effective way to, spread that information. So it would be taking a curriculum that we have, but modifying it somewhat and then expanding it statewide. So we hope we get the opportunity.
This has been wonderful. We're taking some notes, and as I think we noted, we will be continuing to meet with all of our National Training Initiative sites, which everybody, I think Ty posted earlier on in the chat, the direct link to the website where you can actually see all of the states that are participating, but we'll continue to meet with the states throughout this next year. We do have monthly meetings where we talk about best practices, how we're thinking about applying it. The last couple meetings have been about sustainability, and we hope to continue that sustainability and leveraging not just our in-state, but also nationally. We have had a very unique opportunity, I feel like, within University Centers for Excellence in Developmental Disabilities and our Leadership Education and Neurodevelopmental Disabilities to collaborate across the nation in a way that I've been involved in the network, I guess, for 9 or 10 years now, and have really been impressed by our partner engagement and our willingness to learn together and share our work. So if there are other partners who are on the call that want to send additional information to us, we will continue those calls for learning over the next year as well, and hopefully utilize them to maybe even respond to other national or even USDA calls, as Christina mentioned, to continue to support this work. So any other final comments? We have about 2 minutes here before we wrap up. From our Ohio team, from our Wyoming team, from our amazing NTI Scope sites.
I would just say, as a reminder, we will send out the slides to those that registered. If you didn't have a chance to register, please feel free to put your email address in the chat, and we'll make sure that you're included in those slides. And for our sites, we are also recording this webinar so that we will make sure that you access this and you can utilize it and send it out to additional partners that were unable to attend.
The only last comment is I put a conference in November. I put the brochure in the chat box. Feel free to register. I know the big shout out to Janelle in Utah, because I think she has already registered. So we have a really great lineup this year, and a lot of it is based on what we've learned from Project Scope and what our community still needs from a continuing medical education perspective. So it is available for CMEs for any providers in the nation, and then select providers in other disciplines outside of Ohio. So thank you. And thanks for Wynn for organizing this today.
Well, that's it, everybody. Have a great week, and we'll hope to connect in other realms soon.